and good afternoon. My name is James Hospedales. Soy director ejecutivo de la Agencia de Salud Pública del Caribe. I am the executive director of the Caribbean Public Health Association, Caribbean Public Health Agency, CARPHA, headquartered in Port of Spain, Trinidad and Tobago, with offices in St. Lucia and Jamaica. I'm happy to give this talk to the members of the course via ISAC's UNOSUR. For a long time in the Caribbean, we have worked together as small countries, and there is a lot to share of the experience of working together. Today, therefore, I'm going to talk about CARICOM, the Caribbean Community, and CARPHA as Caribbean expressions of regional integration. The presentation will look at the CARICOM community, the Caribbean Public Health Agency, the history of regional cooperation in health, regional health achievements, and I will conclude thinking of the similarities between CARPHA and ISAC UNOSUR. The Caribbean community is a community of 15 independent territories and 5 associate members that is governed by a treaty, the Treaty of Chaguaramas, that focuses on cooperation between the countries. It was established in 1973 with 4 main pillars: economic integration, foreign policy coordination, human and social development, and security. The vision is, as stated, a Caribbean community that is integrated, inclusive, resilient, driven by knowledge, excellent innovation and productivity, where every citizen is secure, contributes to, shares in economic and social and cultural productivity. So this is the overall political economic integration movement in the Caribbean, one of the longest surviving, if not the longest surviving, in the world. The governance structure includes the heads of government, the councils of ministers that correspond to finance and planning, foreign relations, human and social development, national security and law enforcement, and on the right here, the Community for Council for Trade and Economic Development. And this is serviced by a CARICOM secretariat based in Guyana, in South America. Guyana itself is part of UNOSUR. These are the member states of the Caribbean community, comprising the islands: Antigua, Barbuda, Bahamas, Barbados. Belize is a mainland in Central America, so Belize is a member of the Caribbean and the Central American communities. Then Dominica, Grenada, Guyana, Haiti, Jamaica, Jamaica, Montserrat, Santa Lucia, St. Kitts and Nevis, St. Vincent and the Grenadines, Suriname also está en Sudamérica, Trinidad and Tobago, and these are the British dependent territories that are members of CARICOM. So these 20 countries are members of CARICOM. If I look now at the Caribbean Public Health Agency, CARPHA, it is an institution with responsibility for public health in the region, and it is a merger 5 years ago of 5 former regional health institutions covering epidemiology through CAREC, food and nutrition, health research, environmental health, and pharmaceutical quality testing. Established by the heads of government in 2011 and becoming operational in 2013, as I said, headquartered in Trinidad with campuses in St. Lucia and Jamaica. The vision of the region in health is a region in which the health and wellness of people are protected and from disease and injury and disability, and enabling human development in keeping with the belief that the health of the region is the wealth of the region. Our mission as CARPHA is to provide strategic direction, to analyze, to define and respond to public health and development priorities in the region, to prevent disease, to promote and protect health, and respond to public health threats and emergencies. The objectives include promoting physical and mental health and wellness, providing strategic direction through analyzing and defining and responding to public health priorities, promoting and developing measures for prevention of disease, responding to public health emergencies, and supporting the objectives of the Caribbean Cooperation in Health, which is a functional operational initiative that I will talk a bit more in a few minutes. So you see here objectives of a public health agency that spans the whole Caribbean, and CARPHA is also a member of the International Association of National Public Health Institutes, which includes some of the institutes of UNASUR. We serve the islands in the Caribbean, as well as Guyana and Suriname in South America, and Belize. And there you have some of the former colonial history reflected from the British being the responsible for these territories. Our programmatic priorities, number one is the non-communicable disease and obesity epidemic that is a huge burden from a health point of view and an economic point of view. We have made good progress with communicable diseases, but remain at risk of threats, especially with the travel and tourism industry. And so the coordination and maintenance of a strong laboratory network across the Caribbean is a priority for CARPHA, and the provision of reference and referral laboratory services, which underpins regional health security, working together to attain the objectives of the international health regulations. Environmental health and sustainable development, especially given the challenges of climate change that the region faces. Tourism and health. This is the most dependent, tourism-dependent region in the world, the Caribbean region, with over 50 million travel arrivals every year, 25 million in cruise, and 25 million in stayover arrivals. When you compare, in South America, Argentina has 5 million a year. Brazil, which is a big tourism destination, has 5 million a year. The CARICOM countries have 50 million a year, with a population of only 30 or so million. We also have priorities for regulation of medicines and the repositioning of health on the political agenda, which I think is where there is a big overlap between the interests of UNASUR, ISAC's, and CARPHA's work in the Caribbean. The structure is a reporting to the heads of government through the Ministerial Council of Human and Social Development, with a board, myself as Executive Director, and a Science Advisory Committee. Some of the ideas of our future, looking at 2025 and aligning with the Agenda 2030 to have a 25% reduction in mortality. For me, an important target is to get increases in investment in cost-effective public health measures that will better make a better future for us. Reversing childhood obesity, ending all forms of HIV transmission, which we think is possible. Many of our countries are now certified for eliminating mother-to-child transmission. So this is the new frontier. In the next few years, improving environmental health, getting our heads of government to declare the CARICOM as a smoke-free, tobacco-free zone, getting a safer food and drug supply, and attaining the core capacities of international health regulations. Of course, as a new agency, ensuring that this agency, which is an instrument of cooperation, is positioned to survive and thrive in the new world. I hope in that cooperation with ISAC's UNASUR can actually deepen. Now, let me talk a little about the regional cooperation in health, which dates back for many 50 or 60 years, where ministers of health would discuss common issues and try to achieve common policies. And they created a number of regional agencies and institutions to save on transactional costs. Notable include the Medical Research Council that continues until today in CARPHA as the longest running health conference in the whole of Latin America and the Caribbean, 62 years. The Caribbean Food and Nutrition Institute, the Caribbean Corporation in Health, as ways of functioning together. And here I put a slide showing the member states along the base, many partners working together with the CARICOM community, CARPHA, and our major international development partner, OPS, an American health organization, to cooperate, to have healthier people in better, healthier spaces. And more or less, this is the idea of what I'm trying to communicate, that the Caribbean has a long history of cooperating, the countries working with partners to achieve common goals to improve health and environment. And more working to influence the policies of other sectors, taking account of climate change, taking account of the NCD epidemic, taking account of financial needs, taking account of aging and the demographic shift, of gender, a social determinants approach. So, a more formal definition of the goal of the Caribbean Corporation in Health is to improve and sustain the health and well-being of people, and it's a mechanism that allows priority areas to be identified and developing projects to focus and mobilize resources to address health problems of needy groups. This has had some very big successes over the years. In the Caribbean Corporation in Health Phase 1, which ran from 1985 to 1995, the elimination of measles, indigenous measles transmission, was achieved. The first region in the world to do so. I was quite junior at the time. I was an epidemiologist, but we mobilized and prepared for 2 years and vaccinated 92% of children under the age of 14 in 1 month, and transmission stopped. And CARPHA maintains a very strong surveillance for fever and rash, and we've never had any indigenous transmission except imported cases. In phase 2, the big success was the elevating of HIV and AIDS and mobilized the big success at the margins of the World Health Assembly, and then by September of last year, presenting and getting the sign-off of the Council of Human and Social Development on the policy framework for the next 10 years. We're now in part of operationalizing, and CARPHA is a major institutional expression of that Caribbean Corporation Health. This CCH4 has identified a number of priority areas to be addressed: health systems for universal health coverage, safe, resilient, and healthy environments to mitigate climate change, health and well-being of people through the life course, data and evidence for data-making, decision-making and accountability, and partnership and resource mobilization for health. I hope through this dialogue that we strengthen the partnership with UNOSUR, ISACS. Some of the major achievements throughout the years include, as I mentioned earlier, the first region to eliminate indigenous polio, measles, and rubella transmission. This spread to the whole of South America and gives a glimpse of global elimination. The establishment of CARPHA as a unified public health platform and policy platform for health. The Port of Spain Declaration, where the CARICOM heads of government were the first leaders in the world, heads of government, to take up this cause, take it to the United Nations. The formation of the Healthy Caribbean Coalition, which is a 65-member NGO alliance, civil society alliance, to strengthen the cooperation in health to include civil society in addition to the governments. Regional examinations for nursing, a regional approach to the PANCAP, to HIV and AIDS, regional laboratory services network, safe and green hospitals, which is led by PAHO. These are examples of achievements of the functional cooperation approach in the Caribbean in health, which contributes to more sustainable development. There are many similarities between CARPHA and the 30 million people that make up this Caribbean region and ISAC's UNOSUR. We are part of the Americas with a similar, in some ways, colonial pasts, the Caribbean having as well a large amount of the African diaspora and the Asian Indian diaspora with multiple Spanish, British, French heritage in the past, and common problems of demographic shift, aging populations, the sustainability of social security, many health problems that are impediments to growth and development, and threats from climate change, threats from increasing violence in many places, requiring a strong social determinants to health approach, which is what we at CARPHA are about. My office puts a lot of effort into advocating with the other ministerial councils for a healthy public in all policies. We see that they are both intergovernmental organizations serving respective regions with mandates for health surveillance and responding, universal access to medicines, capacity development, knowledge management, health research. And so these are some of the areas that initially appeared to be fruitful areas for discussion as we go forward. I thank you for your time and attention. I've tried to share with you a little bit of the background in the Caribbean, how the countries work together to improve health and development prospects, a little of the challenges we now face, and hope that this can lead to more fruitful cooperation between the CARICOM region, CARPHA as an integrated public health institution, and ISAC's UNOSUR. Buenas tardes y tengan un buen fin de semana.
Thank you very much, Dr. Hospedales. Okay, so whenever you can.
Okay, well, as I have a few more minutes, I can talk about a couple of things that I think are shared challenges of the Caribbean region and UNOSUR, ISAC's UNOSUR. We have a population that is aging, and the need for healthy aging is an economic imperative, not just a health wish. And social security institutions are in our region approaching insolvency because of the demographic shift and high levels of payout for non-communicable diseases, compounded by environment with childhood obesity. So let me be specific. Last week I was in Chile and very proud and pleased to cooperate on a Chile CARICOM project looking at the etiquetado, etiquetado in Chile on labeling. And it corresponds very well to the CARICOM region, where we have a 6-point policy package to tackle childhood obesity, cut childhood obesity in half in the next 10 years, through mandatory nutritional labeling, through product reformulation, through the working in the schools, with the justice system, reducing advertising of junk food to children, improving access to fruits and vegetables, adjusting our trade policy. So a comprehensive package, and I think these are challenges that both regions face that no country in the world has succeeded in solving. But the Americas have always been an experiment, the CARICOM, the Caribbean region, and the South American region. So maybe we can lead the world in reducing the national epidemics of obesity, beginning with the children, through comprehensive reform of the food policy environment. And that requires a strong health in all policies approach and a strong partnership approach with the other sectors, agriculture, finance, education, trade, with the consumer and economic sectors, to try to make an alliance to strengthen the regulation of the food environment, to protect the children and to protect our future. So that's one I wanted to stress. The other is more in the sphere of health security, the issue of the Aedes aegypti mosquito, which is a domesticated mosquito, present in 3 billion people's households in the world, half the world, and throughout South America and the Caribbean. This is a major threat to health and economic security, that we have a vector that is such a competent transmitter of yellow fever, of chikungunya, of Zika, of dengue fever. So the need for innovative research on how to have community-based, technology-enabled approaches and new approaches to deal with it, from sterile mosquitoes to biological control. This is a shared problem that we have, and we are very focused in the Caribbean with the island settings on some of these multi-sector approaches to tackling the problem. And again, I think a health in all policies approach is needed with tourism, with communications, with local government, with community-based organizations. So those are two topics I wanted to conclude on that require both, I think, are common to UNOSUR and the CARICOM region, where the health in all policies approach is needed, that I thought it would be useful to share. Thank you very much again, and have a good weekend.